Hi there, my name is Theo and this is Mia. We are members of a Red Cross and Red Crescent response team. In this video, we're going to talk about setting up and implementing child-friendly spaces, or CFS, in emergencies. A CFS is a safe place where children can be children in disasters. CFS have multiple benefits when they are implemented well. For example, CFS are caring spaces. They are spaces for children to interact with other children and with caring adults, play, learn skills to cope with distress, and care for their mental health and psychological well-being. CFS are learning spaces. In these spaces, children can continue education activities, learn about child rights, develop skills, maintain routines, and have meaningful opportunities to participate in decisions. CFS are safe spaces. In these spaces, children are safe from violence, abuse, and exploitation. In these spaces, they can access local protection referrals and learn new protection skills. CFS reinforce community capacity. These spaces help communities organize child protection committees that represent all community members, including children themselves. In these spaces, there is opportunity to raise awareness of child protection issues and share protection referral pathways. They act as a place for support and services, including restoring family links. To help ensure CFS are delivered in a safe and effective way, there are 6 principles that all agencies can follow. 1. Create secure and safe environments for children. This includes lighting around the CFS, screening all people who visit, and ensuring the site of the CFS is safe from traffic and other dangers. 2. Providing a stimulating and supportive environment for children. This can involve play-based learning and providing children opportunities to lead activities. 3. Build on existing structures and capacities within a community, including local referral pathways, drawing on local services, and linking to local schools so the CFS can be transitioned out as soon as feasible. 4. Use a fully participatory approach in design and implementation. This includes involving children, parents, and community members from diverse backgrounds, ages, income levels, and genders. 5. Provide or support integrated services and programs. For example, working with restoring family links, health and first aid teams so that those services are available through CFS. 6. Be inclusive and not discriminatory. This includes ensuring families and children who are often marginalized are provided meaningful opportunities to provide input on the design and implementation of the CFS and can access the CFS without barriers. If you want to implement a CFS, the following steps must be followed. Firstly, ensure your national society has child safeguarding systems in place. Further, conduct an assessment. In order to implement a CFS, a site must be selected and qualified personnel must be recruited and trained. Also, don't forget to always monitor and evaluate the project. Finally, I want to tell you about child-friendly spaces that can also be adjusted in heat waves to become CFS cooling stations. For example, we use air conditioners, heat pumps or fans to provide a cool space, provide water taps and bottled water to help hydrate, and deliver child cooling kits with water, hydration salts, sunscreen, hats, hygiene materials, and local referrals for protection services. CFS cooling stations can especially target marginalized children, such as children connected to the streets, children in labor, and children out of school. Remember, CFS are an essential part of disaster planning and response for national societies all over the world. CFS are safe spaces where children can be children in disasters.